two characteristics of the MMT series is that we work clothes on through the client's clothing with essentially no oil or lotion and no thumb work. So you'll notice that I'm not using thumbs for virtually anything. So we can displace the iliotibial band from the rear aspect by pushing under it in this fashion and pushing it out of the way and then pressing down to get to the vastus lateralis. So we displace the iliotibial band and then sweep just a little bit side to side. As we come down to the knee, I want to remind you of the lateral collateral ligament running from just above the knee to just below the knee, just in this manner here, to the fibula from the femur, just like that, the lateral collateral ligament. In case of a lateral collateral strain, this ligament can be worked on by finding it just above and below the knee and getting down to it, above it, on it, and even a little bit under it. We'll reposition the client to access the inside leg. When in treatment, I would take it over like this. I would lift your leg, please. I'd bring these two pillows here, bring the upper leg over, and then have her straighten the lower leg, and I then would have access to this leg. I can use two soft fists here on this important yet somewhat tender area can be. The all-important adductor magnus, longus, and brevis are in this region. So it can brace with one hand and treat in this manner. I can even lift her foot up to put some slack in those muscles. Let me just hold it. That's it. With her completely relaxed. Can do a little movement in this manner. And yes, I can access right up to the pubis where the adductors are attaching. So that's the bony prominence that we're going to be up against if we take our touch this high. So I would take the heel of the hand, lay it right there, or perhaps a soft fist or two. Behind the knee, we have the popliteus, and the plantaris muscle can hold this foot up a little bit and treat them very nicely with the opposite hand, gently behind the knee, very gently behind the knee. A little tight right there as I go over the plantaris. Here's the tibia on the inside, and we'll find the medial aspect of the tibia, and right there will be the posterior tibialis. We can ask the client to bring her foot this way a time or two, and there it is as it pops. As she comes this way, I feel it. Very good. And so I can treat that cross fiber. With heel of hand, bracing it. Easy to find it right there and treat it. Can bring it up and treat it a little higher all along that medial aspect. If her pants are falling down and the leg is there, then fine. I don't need lotion on that leg. Can actually do a skin-on-skin glide. It's amazing that we've used lotion for all these years and realize that you get a perfectly nice glide on most all skin without much in the way of lotion, especially if there's not a hairy leg. The more slack we put into the muscles, any muscles that we work on to begin with, the more successful we're going to be. Another aspect that we can do is to bring the knee out in a manner like this. This exposes more of the posterior lateral aspect of the femur and the leg musculature so that we can be on that aspect as well, coming into literally the vastus lateralis and the biceps femoris, the large hamstring muscle. Can scoop with heels of hands, with fists here, with pressure. I've asked my client to move a little bit if she needs me to reduce the pressure, and she did so because that's pretty tender right there on this dancer. So we'd want to be cautious. Just because I'm using fist or forearms, it doesn't mean that I'm going deep. It doesn't mean that I'm going to lean in there and cause her discomfort. On the contrary, I'm going to be cautious. It means that I can work more economically for me without spending a lot of energy to get the same amount of work done. Certainly, we can use the thumb saver anytime on the foot, whether it's held in our hand or placed on the bolster. Can use pressure along the foot without lotion per se to find any tightnesses in the foot and save your thumbs by using the thumb saver. Treating the plantar fascia either with the fibers as I go down or crossing those fibers of the plantar fascia. And what I want to show you is how conveniently the forearm rests right in that space and can easily reach in there and do a lot of excellent treatment without interfering with the bony surface. So I want to show that to you, and then we're going to do that just like that. Here's her iliac crest and the trochanter, and right there's where that forearm sits. And it can be there with compression. It can be there with rolling, literally rolling the forearm with the fibers of tensor fascia lata, and then a cross fiber motion that I can call a sawing motion, if you will, and blending those two from cross fibers to with the fibers. This is the all-important area where we can treat neuralgia paresthetica, the entrapment of the lateral femoral cutaneous nerve, which is right here, right where my finger is now, is where that nerve can be entrapped, causing the burning thigh condition known as neuralgia paresthetica. After loosening up with forearm or two forearms, again, if you're the smaller therapist with a large client with large legs, then two forearms work really well to get a lot of treatment done in a very economical manner and get a whole lot of work done. Working the entire lateral and anterior surface of the most powerful muscle group in the body, the quadriceps. Can lift, reach in and do a bit of myofascial rolling. I don't use my thumbs anymore for skin rolling or myofascial rolling, but to lift with fingers and hand like this, yes, is very easy to do. And you can find the subcutaneous tightnesses in the subcutaneous fascia between the skin and the muscle. So I can mobilize the patella, I can press it medially, I can press it laterally, I can push it anteriorly and inferiorly, superiorly and inferiorly. Ask if there's any discomfort in the patella, and if I'm treating a knee, I would treat especially above the patella, just right above it with the thumb saver or with a forearm right there on that, just above the patella patellar tendon, literally, coming down and crossing the knee. So here I gently rotate the knee inside, and I can use my forearm again to loosen up, stabilizing her foot for movement. I can use the heel of my hand quite easily on the tibialis anterior, loosening it up first. Starting out with it on slack, or a glide with the heel of hand to get some myofascial glide going in that respect. We can mobilize the toes in a flexion or extension. By cradling the knee and the foot, we can do some hip rotations, some nice limbering of the hip. Notice I'll maintain the knee in a 90-degree bend in case you have someone with a knee replacement. You don't want to bring the knee down into past 90 degrees of flexion. So I'll maintain that knee just to show you what I would do with a knee replacement.